My name is Dr. Kadir. I'm a board certified psychiatrist in the state of California. Today we will talk about bipolar disorder type 1. There are different types of bipolar disorder, but today in this video we'll talk about bipolar disorder type 1. So what is bipolar disorder type 1? Bipolar disorder type 1 has symptoms of mania and depression. But to diagnose bipolar disorder type 1, you don't necessarily need symptoms of depression. If you have a manic episode, then you have bipolar disorder type 1. Even down the road, if you have hypomanic episode, still you will be bipolar disorder type 1. For bipolar disorder type 2, you have to have hypomania and depression symptoms, both. So you have to have an episode of hypomania and an episode of depression, and then you will be diagnosed with bipolar disorder type 2. But with bipolar disorder type 1, if you have a manic episode, you are bipolar disorder type 1. So what is manic episode? Let's talk about it. For manic episode, you have to have a duration of 1 week. For hypomania, 4 days is enough. But for mania, 1 week. You have to have an expensive, elevated or irritable mood. So bipolar disorder type 1, when they have a manic episode, either they are very, very happy or they are very, very irritable. Other than irritable mood or very happy mood, they have to have these 3 or more of those following symptoms. Inflated self-esteem or grandiosity. They feel top of the world. They feel that they can create a big business, and it's very out of norm of their personality. So they are very grandiose, and sometimes the grandiosity is up to a point of being delusion. Like some of my patients told me that, hey, I'm waiting for the president of a specific country to come and pick me up, or I am creating a business of Ferraris. So all those kind of grandiosity, or up to a point of it becomes very delusional, like fixed firm false belief. Decreased need for sleep. So it does not mean that they have decreased sleep, but they have decreased need for sleep. And when we talk about sleep, it does not mean that they are not sleeping at night and they are sleeping during the day. For almost 7 days, they are needing maybe no sleep or 2 or 3 hours of sleep. But we also have to figure it out if it's due to any underlying substance use or not. So if they're consuming a lot of caffeine, then maybe they don't have bipolar disorder. Or if they're using some substance like a stimulant or some other substance that can cause decreased sleep, then it will be different than manic symptom. But decreased need for sleep, that they can function with 2 hours sleep, 3 hours sleep, and they have a lot of energy. They just don't need enough sleep. Increased talkativeness. They're talking fast. They're jumping from one topic to another. It's very difficult to stop them when they have started talking. We call them hyperverbal or increased talkativeness. Racing thoughts. They keep on jumping from one topic to another. They will talk about this thing and then they will move to a different topic and then they will talk about this thing. They will say, my mind is racing. They have a hard time focusing on a regular conversation also. Easily distractible. So when they are talking, they are distractible very easily. Increase in goal-directed activity or psychomotor agitation. They are very restless. They are very fidgety, hard time sitting still, almost like would like to walk a lot. So a lot of agitation, psychomotor agitation. And the other one is engaging in activities that are very risk-taking behavior, like buying sprees. They go on shopping sprees, not like normal shopping spree. I know a person who did not have money, went to buy like big cars, or they start businesses when they are in that manic episode, or they become hypersexual also. People can have manic episode with psychosis or without psychosis, because once the grandiosity becomes too much, it becomes very delusional, up to a point of delusion. Sometimes they have like religious delusions also. Sometimes they have delusions that they are millionaire or billionaire, or they know like big figures in the country, or they are talking to them. So all those kind of delusions. And these symptoms necessarily also have to cause problems in their social life, their personal life, their family life, and at work also. So So the manic symptoms will last for like 7 days, and it will cause significant problems in their life, social life, family life, and at work also. And there should not be any substance use involved or any medical reason causing this manic episode, like no drug use like methamphetamine, cocaine, or no medical problem that is causing it. So this is bipolar disorder type 1. You don't need to have a depressive episode for to diagnose bipolar disorder type 1. Only one manic episode for 7 days, 7 consecutive days will cause bipolar disorder type 1. Thanks for watching the video.